Everyone to what I think is going to be an amazing CE workshop to really start pushing the envelope and getting social workers involved in voter registration. Again, my name is Christina Kazanov. I'm part of the Florida chapter of NASW. My executive director for NASW Florida is on the call today, so shout out to Dawn Brown. And we are excited to partner with the New Jersey chapter in Vot-ER. Currently, I am the legislative committee chair, and I'm excited to be able to offer this to all members of NASW Florida, students and future members. Welcome for being here. Our goal is to hopefully inspire all of you through Chelsea's enthusiasm and her hard work at Vot-ER and getting you comfortable with voter registration, to keep empowering you if you're already doing that within your practice and in your agencies, and how we can spread this message to other social workers in New Jersey, in Florida, but across the United States. So it is my sincere pleasure to introduce Chelsea White Hoagland. She serves as the Vot-ER's Director of Organizing Training, overseeing events and materials that Vot-ER offers to develop the organizing capacities and skills of healthcare and human service professions across the nation, such as the Civic Health Fellowship and this webinar. She also oversees Vot-ER's social work strategic efforts, which, yes, for that. She received both her BSW and MSW from Western Carolina University, and has more than a decade of experience in community organizing, dedicated to restructuring political systems, using evidence-based healing practice rooted in her social work background. So we are excited and we are happy to welcome Chelsea to start us off on this wonderful workshop. Chelsea, I'll hand it over to you.
Thank you so much, Christina. And a little last minute addition, a special guest that will be joining me today is my former intern and now a newly graduated MSW, Emily Campanella, who we are very proud of and excited to have join us for tonight's presentation. And we're both going to introduce ourselves a little bit more here in just a second. But I wanted to let y'all know what our intention is for our time together over the next 45 minutes or so. I'm sorry, actually like an hour, hour and a half. I did not change that note in my speaker's notes, sorry. But our intention is to examine the connections between civic engagement, health outcomes, and social work, along with the research that supports those connections. And before we dig into all of that, we're going to give you a little bit of context, introducing ourselves and introducing Vot-ER. For those of you who aren't familiar with us yet, we're going to wrap up today by sharing some of the clinical tools and resources that are available for integrating civic engagement into your practice settings, as well as approaching administrators or institutional leaders, if you need approval or if you are anticipating any pushback around civic engagement integration in your practice. And of course, at the end, like Jeff said, there will be time for questions. Please feel free to drop those in the chat as we are presenting, or hold on to them if that's easier for you. But we want to make sure that we answer any questions that you might be holding today. And also something that is really helpful for me as a presenter is if I know a little bit about the audience that I'm talking to. So if y'all have not already, if you could just drop a little introduction of yourself, your name, your pronouns, where you're tuning in from, and then your area or scope of practice, that'd be really helpful for me. You can just drop that in the chat. So first, going to kick us off with a little bit about your presenters and the organization that we're here with tonight. And normally I share first, but I'm actually going to switch it up a little bit and put you on the spot, Emily, and ask you to introduce yourself first.
Not a problem. So hello, everyone. Thank you so much for joining us tonight. Like Chelsea said, my name is Emily Campanella, and I use she, her pronouns. And as Chelsea mentioned, also, I just completed my MSW about 4 or 5 days ago, which I just cannot say enough because I'm so excited. And I am located in New York State, in the tri-state area of New York, PA, New Jersey. So some of the towns y'all are dropping, I'm like, I know that, I've been there. So it's really nice to have some fellow social workers who are in the area on this call. I have some previous work experience in long-term substance abuse treatment in a mother-child rehabilitation facility, as well as macro-focused work in the intimate partner violence realm. I currently hold the position as the Healthy Democracy Campaign Manager and the Fellowship Associate, I know, long-winded, at Vot-ER. So really being able to connect my on-the-ground experience back to a position that really helps uplift opportunities and support autonomy for not only social workers, but their clients and health professionals all over has been really near and dear to my heart. So I will pass things back over to Chelsea.
Thanks, Emily. So Christina did such a great job at covering my credentials that I want to introduce myself with a little bit of a personal story and some background as to what brings me into this work, because I actually think that in social work and in community organizing, our why is at the heart of everything that we do. So for context, I was born to a poor single mom who was 19 years old when she got pregnant with me. And she was working around the clock, multiple jobs to keep a roof over our head. And meanwhile, I was being raised by a village of neighbors and church members and family and friends across the Appalachian Mountains of Western North Carolina. And the funny thing is that I never actually knew that being poor was something that was looked down on, because in Appalachia, being poor is the standard. The village of folks that raised me were all folks who were struggling to make ends meet, despite the fact that they were all working backbreaking jobs. And these same folks encouraged me to go to college as a path out of poverty. So I actually didn't know that I wanted to do social work when I started college. I was like, I'm going to be a business law and administration major. I'm going to make so much money. It took one semester for me to figure out that was not the path for me. But I went straight to the local public university after graduating from high school because I believed that that was my path out of poverty. And it was during my first year of undergraduate school that my Uncle Randy, who was one of the men who had helped to raise me in my village, and who had my initials tattooed on his forearm, along with the initials of all of my cousins. And that year, he was diagnosed and dying from pancreatic cancer. And so for the first 2 years of my experience in college, I watched while this man, who really should have been the embodiment of the American dream for how hard he worked, because he was constantly coming home late for dinner with calloused hands from working construction jobs to keep the family and the cousins fed. This man, I watched as he faced barrier after barrier to the treatment that he needed and deserved, just to face his diagnosis with dignity and comfort, not even to overcome it, but just to face it. And seeing him struggle after all of the love that he had poured out to me and my cousins and all of the sacrifices that he had made, seeing that struggle filled me with a rage so big that by the time he passed away, I didn't have room left for grief. And recognizing those barriers that he faced to accessing affordable healthcare is really what catalyzed me into just looking and noticing the connections between politics and policies and the challenges that I had witnessed my whole life across my family and my community, and I had experienced for myself: houselessness, substance use, etc., and so on. And at the same time, I was just turning 18 in a political environment where the Affordable Care Act was gaining traction and healthcare was becoming the central topic of conversation across the nation. And so within that context, I jumped in to learn all I could about how to change the situations of suffering that I had seen and had experienced in my community, so that my community and the generations that are yet to come could have a better fate than my uncle and the generations before us. And so I registered to vote that year, and then I started registering other students on campus to vote, and that catapulted me into community organizing. And my organizing expanded to registering hundreds of voters across the region, and eventually working on an electoral campaign in 2016, which you can imagine the contentiousness and the stress of working in a presidential campaign that year. And while I was working in elections, I then saw firsthand the conditions that upheld disenfranchisement. Because despite being hired to work on the campaign, because I was local to the rural communities that I was organizing in, when we hit early voting days, I was being sent to the suburbs hours away and was being told that it wasn't worth our time to knock on doors in rural Appalachia. And it was then that I knew that we could not count on anyone to fight for us but ourselves. And my passion at that point became directed towards building power of and with my people, with poor people, with rural people, because no one politician is going to save the day. Even I can't save the day all by myself. I need all of my neighbors, my cousins, my colleagues, my social work peers, my family and friends to be a part of this movement for collective liberation, because the real power comes through our organized unity. And so with that, I am going to turn it back over to Emily to tell you about Vot-ER's origin story.
So in case you have not heard about Vot-ER, I'd just like to take a few minutes and share with you our story and how we came to be. So Vot-ER was started in 2019 by Dr. Alistair Martin, an emergency room physician at Massachusetts General Hospital. And on one cold Boston winter evening, a woman came into the emergency room with her 2 young children. And she explained that to Dr. Martin that she had just recently moved to Massachusetts with a partner she was now attempting to get away from due to experiencing intimate partner violence in that relationship. So she had been sleeping with her 2 children in her car because she wasn't sure where else to go. And she told Dr. Martin that she had looked in the back seat and saw her youngest child shivering and knew in that moment that she could not stay one more night in her vehicle. So she came to the hospital. She told Dr. Martin that they were cold, hungry, and that they needed help. And when faced with that dilemma, Dr. Martin did something I know we aren't shocked to hear. He called the on-duty social worker. And the social worker explained that Massachusetts is a right to shelter state. So this means that if you are an eligible Massachusetts resident and you have children, you cannot by law be left out in the cold. Whether that means there's a room available in a shelter or whether the government has to pay for you to sleep in a hotel, they will make sure that you sleep under a roof. And there's only one other place quite like Massachusetts in this regard, and that is New York State. But because this mom had just recently been brought to Massachusetts, she was unable to provide the needed documentation. And when Dr. Martin explained that to the social worker said, not a problem. We can register her to vote in order to establish residency if that's something she's open to. So when Dr. Martin went back to the mom and asked if she would be interested in registering to vote, the woman looked up at him and said, no one had ever asked me that before. I didn't know that was something that I could do. And that was the light bulb moment for Dr. Martin and the inspiration behind Vot-ER. So Vot-ER is a nonprofit, nonpartisan organization founded in 2019 to bring voter registration into the healthcare space. Vot-ER works to provide patients with the opportunity to register to vote within the healthcare system, leveraging the reality that our healthcare experiences are determined by the policies our elected officials implement. Since our founding, we've expanded Vot-ER into over 700 hospitals and clinics and helped more than 60,000 Americans prepare to vote. We have built partnerships with a collection of hundreds of phenomenal partners like the NASW, who have partnered with us on our Healthy Democracy campaign during Social Work Month, along with other individual state chapters of the NASW and others like the American Academy of Pediatrics and the National Association of Community Health Centers, just to name a few. Most of us are familiar with the way that the DMVs are equipped to register people to vote. So my question is, why don't we do the same in hospitals and our service clinics? Americans often have more regular interactions with their healthcare providers than with the DMV. In fact, an individual has up to 4 interactions with a healthcare facility each year. But do you remember the last time you went to the DMV? Healthcare institutions are important community touchpoints, and bringing voter registration into this space will allow for more individuals to participate in our democracy and improve their health and the health of their communities. Vot-ER's platform is built on this mindset, and it allows service providers to have the conversations with their community members about civic engagement, while ensuring that the provider remains nonpartisan and confident in their conversations. Voter registration belongs in hospitals, health centers, and clinics just as much as they do in the DMV. So I'm going to pass things back over to Ms. Chelsea.
Emily. So now we're going to talk a little bit more about the research and the connections that are demonstrated between civic engagement, social work, and health outcomes. So voting is a powerful tool for advocating for what we care about, including our health, including our mental health, including our families and communities. Research has shown that increased voter participation can lead to healthier communities by giving individuals more autonomy and a sense of connectedness through the democratic process. By empowering patients and clients to think about how policy impacts their lives, we can give them the agency to make informed decisions about their health and their livelihood. Additionally, addressing the social and structural determinants of health through the power of the democratic process can lead to more comprehensive and effective solutions for improving health outcomes. It's really important to remember that health and human services aren't just about treating illnesses and treating symptoms and addressing the problem in front of us, but it's also about addressing the underlying factors that contribute to poor health and poor mental health and other poor outcomes. So as a starting place, when we look from a distance at the group of voters that are unregistered or unlikely to participate in the democratic process, we see that the group of voters that is eligible to vote, but that is unregistered or not participating, shares an overlap with the communities who have been historically underrepresented and marginalized that are also likely to interact with social workers at some point in their lives for a variety of reasons. Folks that are young, low income, Black folks, Indigenous folks, other people of color, members of the queer and trans community, rural people, etc. And there's an opportunity here to bring potential voters into the electorate via a trusted messenger. We know that social workers are developing a unique therapeutic relationship that allows us to serve as trusted messengers in regards to providing accurate information about civic engagement. And with that comes this opportunity for bringing these potential voters into the electorate who otherwise would be excluded. So we keep mentioning the social determinants of health. I know most of us are familiar with that, but as a quick recap, what are the social determinants of health? These are the conditions in a person's environment that have a significant impact on our health, well-being, and quality of life. Social determinants of health include a huge range of factors like safe housing, transportation, neighborhoods, education, job opportunities, income, access to nutritious foods, physical activity opportunities, polluted air and water, language and literacy skills, and the list goes on. And these factors can contribute to wide health disparities and inequities, with some populations facing greater challenges in accessing healthcare, education, economic stability, etc. Healthy People 2030 is the National Health Promotion and Disease the National Health Promotion and Disease Prevention objectives by the U.S. Department of Health and Human Services. And these objectives recognize the importance of addressing the social determinants of health, and they have set data-driven national objectives in 5 key areas: healthcare access and quality, education access and quality, social and community context, economic stability, and neighborhood and built environment. It's important to note that simply promoting healthy choices will not eliminate health disparities. Instead, public health organizations and their partners in sectors like education, transportation, human services, housing, and so on need to take action to improve the conditions in our lived environments. This includes addressing issues such as poverty, discrimination, and limited access to healthy foods, safe housing, and transportation. By addressing these underlying social determinants, we can work towards improving health outcomes and reducing longstanding inequities in health. And In June of 2022, this past year, the American Medical Association formally recognized and solidified that voting is a social determinant of health. And this was made possible by Vot-ER med students that worked collaboratively with the National Medical Association and the Minority Affairs section of the American Medical Association to pass this resolution. We've received a plethora of confirmation from individual providers, professional organizations, healthcare institutions, that this is a game changer and gives immense credibility to the work that they're doing on the ground. 80% of what determines a person's health happens outside of the hospital or health clinic. And social determinants of health play a major role in shaping health outcomes. Health professionals, social work professionals, aspiring social workers, and health professional students are in a unique position to help improve patient health by addressing these underlying social determinants while also reducing the harm of whatever is presenting at the moment in time. Vot-ER is a solution that allows health professionals to take action and make a positive impact on patient health outside of the traditional healthcare setting by providing tools and training to help health and human services professionals to register their patients, clients, community members, and colleagues to vote. Vot-ER helps to empower our community members to take an active role in shaping the policies and conditions that affect their health, our health. Health professionals and social work professionals can take an extra step towards improving the overall health of their clients and community members by encouraging them to participate in democracy in a nonpartisan way. And this can help to address the social determinants of health and create fundamental change that leads to healthier communities in a sustainable way. When the folks that we provide services to or that we work with are excluded from the democratic process, not only are they not being heard by the politicians, the candidates who are running for election that are then going to go on to make the decisions that impact their lives, but they are also being thrust into a harmful feedback loop that undermines their prolonged self-determination and autonomy in the civic process. What a lot of folks don't realize, and I can attest to this from my time working on political and electoral campaigns, is that voter files and information about how we engage in elections is all publicly available information. We can't see who people vote for necessarily, but we can see how often they vote, when they've registered to vote, when they have changed addresses or vote in a different location. So what happens is political campaigns, like a lot of the services that we provide in nonprofits, operate on limited resources. That means that they only have so much money, only so many volunteers, and only so much time. And they have to just strategically decide how they're going to utilize those resources in a way that maximizes the outcomes towards their goals. Unlike us in helping professions, where we want to help as many people as possible, and that's usually our end goal, their end goal is to win the election, which means that they want to get voters to vote for them, which means that they're going to use those resources on talking with voters that are going to take less effort to get to the polls, voters who are more likely to get to the polls than voters that are going to take more time, more money, more volunteers, so that they can save their campaigns those resources and reach more people in the long run. So then, for all of the voters that they don't talk with, those voters likely aren't getting contacted by any candidates or any political campaigns. And more often than not, they end up feeling ignored, unheard, apathetic. None of those people care about me anyways. Why would I vote in this system? So on and so forth. And as a result, they end up sitting out the election more often than not. And then they reinforce the political campaign's practices. Oh, we didn't think they were going to go vote. They didn't vote. They proved us right. And so then in the next election year, they're not going to follow up again. They're still not going to get talked to. And those politicians that end up winning the election and serving as elected officials don't shape policies that reflect the needs of those excluded voters because they never heard from them in the first place. And you can't represent people that you don't even talk to. A good way of imagining the impact that voting has on health is by imagining a stream of water and by thinking about the opioid overdose crisis as a prime example. So upstream at the very tippy top of the mountain, we've got our structural determinants, and these are the policies that our elected leaders are putting into place. These are the decisions that they are making on our behalf. These can lead to the environments that we live in and the health inequities that we often refer to as the root causes of a lot of health issues. As we think about the settlement funds from the opioid settlements that just recently got settled, as they make their way to the decision makers who will ultimately determine how the money is spent, we could see those elected officials choose to invest in those dollars into interventions that work and are rooted in evidence, ranging from youth prevention efforts to harm reduction programs to communications campaigns that address stigma. Or we could see those dollars be invested in interventions that aren't backed by evidence and are likely to have a harmful impact on those in active substance use and recovery, such as heavier policing. So then we get to where these houses and these trees are, and this is our social determinants. These are the results, the downstream effects of those structural and political determinants at the top of the mountain. These are the conditions and the environments that people live and grow up in. This is what ultimately lead to a number of possible health outcomes. So going back to our example of the opioid settlement funds, we can imagine the environments that our clients live in, the access that they would have to recovery treatment centers in their community or not, based on how those funds are used. We can imagine environments where stigma is addressed and prevention programs are introduced at young ages. Or in contrast, we can imagine environments where there is no preventative communication happening outside of law enforcement, where there is no access to Narcan or safe use practices. Ultimately, the downstream effect of the structural determinants are the health outcomes that show up in our clients and in our community members. These are the rates of addiction that we see and that we work with. These are the rates of overdose and overdose deaths that we see in our communities. These are the infections that show up in our ER rooms from unsafe injection practices, generational substance use struggles, and so on. So, in order to prevent negative downstream health outcomes, we need to make sure that the voices of the communities that we serve are being heard in the democratic process at the top of the mountain by helping, in order to help to determine the direction of the river's current as it flows down to inform the environmental circumstances that our clients are exposed to and immersed in. And that is why we do the work that we do at Vot-ER. There are approximately, as of the last time we looked at this number, 51 million eligible people in the United States that are not registered to vote. So the big question is, why are so many people unregistered? One of the main reasons for this is that many people have straight up never been asked to register. Research has shown that over 60% of adult American citizens have never been asked to register to vote. And this rate is similar among both people who actually are registered and people who aren't registered. And the most common context in which individuals are asked to register is at motor vehicle agencies, social service agencies, or other government offices. We also know that the folks who aren't registered and aren't participating are the very ones whose voices need to be heard at the top of the mountain we just saw. There was a poll by YouGov that found that non-registered Americans were much more likely to support policies that would increase government aid to the poor and disadvantaged, including policies like a higher minimum wage, a tax cut for the middle class, and free community college. For example, 63% of non-registered individuals supported free community college compared to 43% of registered individuals. If voter registration opportunities existed in every space where community members receive services, this percentage would change dramatically. By making voter registration more accessible and convenient, healthcare and human services professionals could play an important role in increasing voter participation in our democracy. As social workers, most of us lean on a person and environment lens to assess the challenges and solutions across micro, meso, and macro levels of change. And as service professionals, we can intervene with all kinds of treatments for the issues that are being presented by our clients. but social workers in particular are called upon and provided with the specialized skill set that's needed to impact the cause of those issues, the underlying conditions and systemic structures that are at the root of the issues that our clients experience. And we do this through civic engagement. In order to address the social determinants of health, we need to point our interventions towards the political determinants of health. This is clear in what the research has come to show as well, and the connections between civic engagement and health outcomes are only becoming more clear every day. So on the individual level, we see civically engaged folks experience improved mood, self-efficacy, self-determination, dignity, empowerment, social connections, and health outcomes in general. One 2008 study followed individuals for multiple election seasons and found that those individuals reported lower self-reported health scores in the years when they didn't engage in the democratic process. Ultimately, that study found that voting abstention has negative lifetime health effects, and that participating in the democratic process shows potential for being instrumental to well-being. An analysis from 2015 of 44 countries, including the United States, found that voter participation was associated with better self-reported health, even after controlling for individual and country characteristics. Another study from 2019 found that voting among adolescents was associated with less risky health-related behaviors and fewer depressive symptoms in young adulthood. And even another study from 2001 found that socioeconomic inequality in political participation, which was measured by voter turnout, was associated with poor self-rated health, independent of both income inequality and state median household income. That study found that individuals living in states with high voting inequality had increased odds of lower and poor self-rated health compared with individuals living in states with more equally distributed voter turnout. It also found that the absolute level of voter turnout in each state was a powerful predictor of fair and poor self-rated health, even more so than voting inequality. On the mezzo level, on this group and interpersonal level, through our own work at Vot-ER, we have found that providers who integrate civic engagement into their work also see immense benefits for themselves. Healthcare providers, social workers can often struggle working within the system that doesn't actually meet the needs of those who are most vulnerable and who have been historically underserved. We are familiar with this in social work, but the same can be said of healthcare professionals, doctors, physicians, nurses, and so on. Engaging with patients and clients around civic participation has been an outlet for providers to make a positive impact for the very patients who they often feel like they don't have the resources needed to serve. Vot-ER surveyed the medical students who got involved in our first rendition of the Healthy Democracy campaign back in 2020, which we're going to hear more about this year's rendition later from Emily. And the respondents to that survey overwhelmingly reported that during their time, they developed skills and gained knowledge in several aspects of civic engagement, including community organizing and communication, but also that they built out their vertical network between team members of different professional ranks at the same institution. 93% of survey respondents said that their efforts represented a positive, immediate impact that they can have on their community and their community's health. 79% said that Vot-ER increased their sense of connection to other healthcare providers. 51% said that Vot-ER helped to prevent workplace burnout, and 81% said that doing this work made them feel more hopeful in the work that they were doing. And finally, when we zoom out to the macro level, the policy level, we see that policies that more effectively solve public health problems are more likely to be implemented when vulnerable populations participate in civic engagement and when voters turn out in larger numbers that are more representative of the broader electorate. A large body of evidence suggests that more inclusive voting leads to more inclusive and equitable policies. These policies then shape the social determinants of health. In essence, who turns out to vote and in what numbers matters. It affects our policy. When we include the voices of the most marginalized populations in the democratic process, the results are policies that are more effectively meet the needs of those populations and are less likely to cause harm or further contribute to the vulnerability of those communities. In 2012, there was a study that assessed the effect of the Voting Rights Act, and which removed the racially targeted literacy tests in 7 out of the 11 Southern states in 1964. And it was assessing the effect on the amount of resources that were allocated to majority Black localities. And that study found that largely Black localities that saw increases in Black enfranchisement also saw an increase in their portion of the state's resources. Multiple studies on women's suffrage has found that women's suffrage after gaining the vote has increased government spending, including spending on health, and has been historically tied to contributing to cutting child mortality by 8 to 15%. A study of Latin American countries from 1970 and 2008 found that the adoption of free elections in those countries boosted spending on education, health, social security, and welfare. Another study in 2012 of 85 democracies found that higher voter turnout led to larger government expenditure, higher total revenues, and more generous welfare state spending. And then the last thing I'll say about this is it's not only just beneficial in general, but it's substantially beneficial, the effects of voter turnout. Research shows that expanded turnout to include marginalized populations has the potential to increase the amount of money going into public support programs by 1/3. So whatever your agency budget is, take 30% of it, add it to it, and then imagine if all of the agencies represented on this call tonight had an extra 30% of their current budget. What is the kind of impact that we could make? And then perhaps most importantly, what we're seeing in this graph is that this works. Voters who are engaged by nonprofits turned out at rates that were like 11 percentage points higher than comparable voters who were engaged by political campaigns or traditional get out the vote programs. This is showing that Asian, Black, and Hispanic or Latinx voters who were engaged by nonprofits had turnout rates up to 16 percentage points higher than comparable voters. Young voters who were engaged by nonprofits had turnout rates up to 20 percentage points higher. And voters referred to across the industry as low propensity, which we prefer to refer to as high opportunity because it's a metric of their likelihood to turn out if there is no intervention. So there's a high opportunity for intervention. But those high opportunity voters who were engaged by nonprofits where they received services had turnout rates up to 18 percentage points higher. And I'm sorry, my source got cut off here, but this is from Nonprofit Vote's executive summary from 2018. And then we confirmed this in our own work at Vot-ER. We've learned since we got started in 2019 that healthcare-based voter access works and also results in higher turnout by almost 20% as compared to those traditional get out the vote programs. And not only is this intervention effective, but if you ask me, it's expected of us as social workers, regardless of our field of practice. I know that there's a lot of tension and critique surrounding the conversation of the professionalization of social work and the separation between clinical and macro practice, but the truth is that they are deeply integrated and that this work is at the core of who we are as a profession. Take, for example, this definition of the social work profession, which I pulled from the International Federation of Social Workers, which emphasizes the focus on social change, social cohesion, social liberation, and social justice. To read this off the screen, just for accessibility purposes, the global definition says, social work is a practice-based profession and an academic discipline that promotes social change and development, social cohesion, and the empowerment and liberation of people. Principles of social justice, human rights, collective responsibility, and respect for diversities are central to social work. Underpinned by theories of social work, social sciences, humanities, and indigenous knowledges, social work engages people and structures to address life challenges and enhance well-being. And then I also want to just pull out some key statements from our professional code of ethics to illustrate how doing this work and integrating civic engagement into our practice is literally our job, no matter what setting you work in, whether that's clinical, bureaucratic, advocacy, or something else entirely. So the first one I wanted to lift up is that our primary goal is to help people in need, ... and to address social problems. It's one full sentence. There is no stop in between. And addressing social problems requires us to invite our clients to participate in the democratic process as the ones who are the most directly impacted by the social problems that they're coming to us for. Ignoring the role of the civic process in catalyzing and maintaining social problems denies an entire scope of evidence-based intervention opportunity. The second ethical principle that I wanted to lift up is the one that states that social workers challenge social injustice. The NASW reminds us that in order to challenge social injustice, we must lift up the voices and the power of those who are suffering at the hands of injustice. Our code of ethics specifically calls on social workers to ensure access to meaningful participation in decision-making for all people. The third ethical principle that I wanted to lift up is that social workers recognize the central importance of human relationships. And this is the ethical principle that often gets forgotten about or left out of the conversation when we talk about the intersection of macro and micro social work practice, at least in my experience. But it has also been my experience that human relationships are the fabric of the shared communal power that is needed to address social problems from this grassroots level. Civic engagement offers human connection in a powerful, solution-oriented way. And civic engagement isn't just about an individual's relationship with the systems that impact them, but it's also about their relationship to their community and the shared impacts and experiences and their sense of empowerment to create shared change for one another when they speak their collective truth within those systems. And then the fourth ethical principle that I wanted to lift up is that we respect the inherent dignity and worth of all people. Social workers promote our clients' socially responsible self-determination. And in my opinion, one of the easiest and most crucial ways for social workers to promote this with our clients is by inviting them to participate in civic engagement. We seek to enhance clients' capacity and opportunity to change and to address their own needs. But if we don't include civic engagement as one of the capacities that they can seek to enhance, then we're missing a major opportunity for our clients to engage in change and addressing their own needs along with the needs of their community. But I've talked for long enough, and you don't just need to take my word for it. I'm going to play a very short video so that you can hear straight from other social workers who have been doing this work on the ground in their practice.
Vot-ER was inspired by an experience that I had with a social work colleague taking care of a patient right here in this emergency department. And social work really is at the core of what makes Vot-ER so special.
Voting is social work. Integrates voter registration and civic participation into social work, education, and practice nationwide. We work with schools, professional organizations, and agencies around the country.
Social workers have always understood the importance of voting to political action, community power, and social change. Since its founding in 1955, the National Association of Social Workers has promoted open access to the ballot box.
The Healthy Democracy Toolkit is an important additional clinical tool that I use that both helps me build on the legacy of voting rights in the social work profession, but also helps my clients have a say in the policies that affect their day-to-day lives.
After every biopsychosocial assessment, I like to ask my client if they've registered to vote and then assess different barriers that maybe my client has experienced either in the past or currently in terms of registering to vote or getting out to vote in a safe and healthy manner.
Empowering clients to vote by integrating voter registration into my clinical practice has been transformational. Registering our clients to vote and explaining the way their vote matters, especially in local elections, is a way we can empower our clients to be heard.
Voting is good for you and for our society. People who vote report more employment, better health and mental health, stronger social connections, and most important, a greater say in the decisions that affect their lives. Without the vote, there can be no social justice and no democracy.
Elections happen every year. Voter engagement and education is part of our social work code of ethics. But where do we begin? You can start by helping your clients get ready to vote.
Right. Sorry for my mouse floating around in there for a second. I was trying to figure out how to turn it up for you guys, but my computer was being a little difficult. I'm going to now turn it over to Emily to tell us about some of the actual tools and resources that we offer so that you can take this back to your practice settings.
Perfect, thank you. So let's jump into some of those clinical tools and resources. Vot-ER is making it super easy for social work professionals and professionals across the entire spectrum of the healthcare and human services to incorporate civic engagement into their practice by providing compliant, safe, and nonpartisan tools. And I'm going to start by talking about the tools that you can use during your interactions with clients and community members for voter engagement. And then we will touch on some of the resources that are available for approaching administrators and similar individuals within an institution. When it comes to engaging with voters, Vot-ER provides a plethora of free tools for you to use in your practice setting. Individual badge backers and digital posters, patient handouts, and even conversation starters on our website to support professionals with the process of inviting their clients and community members to check their voter registration, vote by mail, and otherwise get ready to vote. All of our tools are intended to complement the services that you provide, not interfere with them. As Chelsea mentioned, social workers in particular have a professional commitment to a healthy democracy and health equity. Registering our clients with Vot-ER's tools is an easy, nonpartisan way to do that. Scanning the QR code or visiting the link is a patient-led, self-directed action. It is completely optional and does not interrupt providers as they care for their clients, and it's always politically neutral. So how do our tools work? Vot-ER's badges, printable posters and flyers, digital backgrounds, etc., all include a QR code and or a short text code and a web URL that are unique to the provider at your institution. Most of us know what a QR code looks like, and when I'm saying short text code, I'm referring to the option described as text vote Salisbury to 34444, like shown on the screen. Clients can opt in to engage with these tools in one of three ways. They can use the camera on their smartphone to scan a QR code from either the badge, a poster on a wall, a waiting room TV, or any other resource we have available. Alternatively, they can also use any cell phone, including an old school Motorola, to text the short code to 34444. Or they can use any device to visit the web URL in a web browser on a phone, tablet, computer, etc. And if you work at a community resource center, perhaps, that has computers available, this would work in that way as well. Regardless of which method a client chooses to engage with, they will be taken to a landing page that looks something like this. From there, they can choose whichever option that works best for them. Register to vote, check their registration, or request an absentee ballot for an upcoming election, or learn more about upcoming elections in their area. One of the questions that we are frequently asked by providers is, what if a client has questions about voter registration that I cannot answer? The good news is that your interaction with the client should only involve you inviting them to engage with the tools. Our goal is to incorporate civic engagement into your clinic while maintaining respect for your priorities as service providers. And the job that you are signing up for, the job that you have already signed up for, which means that we don't expect you to walk them through the process of registering to vote or any of those other questions. We actually have a partnership with a nonpartisan organization called Vote Riders, whose mission is to be able to answer those questions from voters and provide them with accurate, up-to-date information related to voter registration, election laws, and voting requirements. On the landing page, clients can choose the option to contact the helpline. And you can let clients know that they have any questions related to the registration process. They can directly chat with someone that can answer all of those questions as quickly and easily as using that button. Also, at the very top of the page, there's a button to convert the tools to Spanish for patients who that is their primary language. So there is no better way to learn the tools and how they work than trying them out for yourself. So we're gonna give us a quick shot and we're gonna do this all together. On your screen, you're seeing a QR code that is attached to the Lions at St. Leo's University. And St. Leo's social work department is actually one of the teams participating in Vot-ER's current Healthy Democracy campaign. So we're gonna get some hands-on experience using tools while we're also gonna get those students some additional points on this year's leaderboard. So right now you can use your phone to scan the QR code or text the code, and you can also visit vote.health-our institution in your browser window. So let's take a quick 30 to 60 seconds together, do any of those options. And then if you'd be so kind, once you have completed that, drop an emoji or a done in the comments so we can see how many people utilize these tools.
Just clarifying, so the link will change for each institution. So it says like our institution in the generic notes. For this exercise, you'll be visiting vote.health/lions, which I also dropped in the chat. Awesome. John's done, Sharon's done, D'Angelo. Awesome. You guys are fast. Look at this. So many lovely folks who have confirmed their registration. Look at this. Awesome. Well, no rush. You can keep finishing up if you have not finished yet. But I am going to take us into some examples of how we might start the conversation with our clients and with our community members, because I feel like usually that's the most intimidating aspect of this work for a lot of folks who aren't used to civic engagement in healthcare spaces. So like Emily said, when you're using these tools in your practice settings and engaging with your clients in real time, your role as a service provider is really to just invite them to engage with the tools if and when appropriate, and to show them how to pull up the landing page, like point to the QR code so you can scan this with your camera, and then just let them take it from there. It's really, oh yeah, I can definitely put that back. But it's really like a 20-second task of retired person online, love that. But it's really a 20-second task of just asking them if they are registered to vote at their current address, or if they're interested in registering to vote. And if you're wondering what it looks like to invite your clients to engage with the tools, the answer is that it really can be adjusted to look like whatever works best for you and fits into the structure of your services and visit, because we know that y'all are working in a lot of different environments and your patient and client interactions actually are structured differently accordingly. But that said, we have collaborated with some voting experts and some healthcare professionals to provide scripts that are nonpartisan, research-backed, and appropriate for most clinical and professional settings. And these scripts are all available on our website, but I wanted to give you an idea of what they look like tonight with a couple of examples. So one of the ways that you can introduce the tools to your clients is during the social history portion or the intake portion of their visit. So while you're asking other questions like, do you smoke? Do you drink? Are you safe at home? Are you a veteran? Are you registered to vote? They happen to say no. Oh, well, I happen to have this handy dandy badge. When you leave my office today, you can just point your camera right here, scan the QR code, and then after you leave, take a few minutes to fill out that voter registration form. And there's a helpline that can answer any questions that you might have. Another way to introduce these tools to your clients is at the end of their visit. So this can be especially useful in private practice settings. It's like a one-off conversation with when you might be working with a small group of clients who you see on a recurring basis. And so at the end of a session with one of your clients, you might want to say something like, before I leave, I'd like to check if you're eligible to vote and registered to vote at your current address. This is a small election year that doesn't get as much attention as the big national elections, but your vote is especially a powerful tool to address and improve issues you care about, like your health, and especially so in local elections, which are often decided by a very small number of voters, and the impact on your community is immediate. Through your vote, you have a say on issues like prices of medication, the cost of health insurance, and the things that we've talked about today in our session, and other things that affect your friends and family. To check your voter registration, all you have to do is point your camera at this QR code on my badge or text this number right here, and it'll take you to a platform that will help you through every step of the process. And there's a helpline that can answer any questions you may have. So the key to all of these initial invitations, regardless of when or how you initiate them with your clients, is to focus on the power that our vote has when it comes to bringing resources into our communities, like the resources that we offer as social workers. So we can remind our clients and colleagues that even if they just pick one race to vote in, they can still help shape what resources our community, your community, has access to. So for example, pick just one office that would have an impact on your life. For example, the governor distributes resources to cities across our state. The state assembly allocates resources to schools across our state. Our congressional members secure resources for our state. I think often people think that they have to be all or nothing. I have to fill out every bubble on my ballot, or I can't vote at all, but that's just not true. You can pick one, familiarize yourself, go cast a vote in that one. And part of building rapport as social workers is knowing how to talk about challenging or uncomfortable topics, which I think we can all agree that elections, especially in this day and age, are contentious, challenging, and very uncomfortable topics, even when we are approaching them nonpartisanly. So regardless of what type of setting you work in, recovery, intimate partner violence, mental health treatment, foster care, etc., you can still refer to the resources at hand and use these evidence-based talking points to talk to anyone about the power of their vote. It's as easy as a 1, 2, 3 formula. 1, introducing the concept of voting as a powerful tool. Before I leave, I'd like to check if you're eligible to vote and registered to vote at your current address. Your vote is a powerful tool to address and improve issues you care about, like the ones we've talked about today. 2, bridge with relevant dialogue about how a small number of voters can make a big difference in our local community elections and resources. So local elections and resources are often decided by a small number of voters, and the impact on our community is immediate. Through your vote, you have a say on issues like prices of medication, cost of health insurance, and so on. And then 3, invite them to take action by scanning the QR code or engaging with the materials in another way. Social workers are also particularly prepared for dealing with the skepticism and the cynicism that surrounds the democratic process today. We have the tools to validate and affirm the sense of hopelessness and powerlessness that a lot of folks are justifiably feeling right now, while also walking them through the cognitive dissonance and overcoming the barriers that they experience around participating in the democratic process. I often refer to my use of motivational interviewing in my work as a community organizer. I use motivational interviewing practices almost every day. And you can see that actually play out in this example on the screen. When someone says, like, why would I vote? None of those people care about me anyways, it's pointless. We can respect their autonomy and affirm their experience. I hear that. You are not alone. So many of us are feeling that way right now. And then expressing some compassionate curiosity, evoking their sense of connection to the civic process and their understanding of the issues that impact them. So there's also so many elections that are decided by very few votes, especially in our local elections that affect our everyday lives. In a perfect world, what would be different about our local community? And then we engage with them as a collaborative partner who wants to be a resource of information that ultimately will support whatever they decide, even if that is not voting. So I just want to make sure you have all the information that you need to make a decision for yourself, so that if you do want to vote, you can do that. And then we also get asked here at Vot-ER, is this even legal? Can we even do this in our clinic? And the answer is a resounding no. No, I'm just kidding. It's totally legal. It is affirmed by, I had to see who was still paying attention. So it is totally affirmed by the National Voting Rights Act of 1993, which actually encourages this type of nonpartisan voter registration in health centers in particular. And this is a really important thing to be able to mention to any institutional administrators that may be cautious about allowing you to do this work. So, am I hearing someone? Okay, so speaking of administrators, we imagine that there may be more than one of you who are worried about some kind of pushback that you might get from institutional leaders. And we also have tools and resources that can prepare you for having those conversations, for making the pitch when the time comes. And the good news is that we don't expect you to like reinvent the wheel when it comes to giving presentations or having a handout ready for like why we do this work and why it's important. Our colleagues at Vot-ER have put together some really incredible rinse and repeat resources that you can grab. You can use them as is. You can edit to fit your needs if you feel so inclined. So not only do you not have to make these things from scratch, but you also can hand over the baton at any point to your colleagues across the institution so that they can start recruiting supporters from a different department or a different area of your institution. We are all stronger when we work together and we can get a whole lot farther. So that is the idea of this. So I wanted to show you a couple of examples of the presentations that are available to you. Again, just like our conversation starters, these are available on the website. I'm going to show you where here in just a second. But you can make a copy of these presentations, edit them to fit your needs. If you've ever used Google Docs, that's the platform that we use for these. So this example is of a slide deck that can be used in a lot of different settings to just talk about Vot-ER 101. It's about introducing Vot-ER to colleagues, leaders at your institution, in case they have never heard of us before and they think that you are being scammed or have bought into some kind of pyramid scheme. And you can show them that you have not, and it even comes with speaker notes. So that's what you can see at the sort of bottom of the image here underneath the slides. So that way you don't even have to come up with what you're going to say. You can literally read from these slides if you want to. And this has been used by providers at Duke University, at the local Veterans Affairs Restoration Quarter in Asheville, which I recently discovered was the second largest in the country, which is pretty crazy. And so much more to get folks familiarized with our work when you're trying to get it integrated. And yes, I can absolutely send these slides to you, Yolanda. And in addition to the slide deck about Vot-ER, just overview and the tools, we also have this slide deck that's more about civic engagement and health and the connections between them. So this is more of the research and exclusively focuses on that link and justifies the work and the connections between health and voting and social determinants of health and structural determinants of health. And so these are really great for justifying why the work is relevant in whatever institutional setting you're working in, especially if this is a new concept to folks, if they're in that pre-contemplative phase of change, right? They've never heard of it before. And just like with the first slide deck that I showed you, speaker notes are included, and you are welcome to make a copy so that you can edit and suit these edit these to suit your needs as well. You can even combine the two if that's what you need. And the best part of these resources, like I've mentioned, is that both of these slide decks, along with there's one pagers that kind of summarize all of the content of the slide deck if you needed a handout per se, and many more are all available right from Vot-ER's website. So you don't have to go digging through your emails after this event. You don't have to reach out to someone and wait for them to get back to you in order to track down the slide deck that you want to use for talking to people at your institution. Instead, because the last thing we want to do is hold back your progress, because I know that you're all going to walk away from here and like immediately be ready to take action after this exciting 90 minutes together. So from the very main page of our website, there is a resources tab on the menu bar at the top. You can just click on that tab and then click on the resources again from the drop-down menu that drops down. And then you'll see these slides and along with a slew of other helpful materials. And with that note, to wrap us up, I'm going to hand the mic back over to Emily to tell us about Civic Health Month, which is the perfect excuse to use our tools and bring this to your institutional leaders and to share. And Emily's going to share with us many mobilization and engagement opportunities that are available to you in the weeks ahead.
Hi, it's
Heck yes. So like Chelsea mentioned just a moment ago, this month is Civic Health Month. And it is the perfect time to integrate civic engagement into your health and human services practices. There's so many opportunities to learn more about our work and deepen your engagement within the weeks ahead. So every August, over 300 organizations nationwide, including the American Medical Association and the National Medical Association and the National Association of Social Workers, join together to celebrate, learn, and take action to improve the civic health of their communities. The NASW chapters hosting this webinar are Civic Health Month partners, and we would love for those of you who represent our work within other institutions to bring your institutions into the fold as partners too. For more information on Civic Health Month and becoming a partner, you can check out the website at the link that Chelsea is going to drop for us in just a moment. And in addition to signing up as a partner for Civic Health Month, you can join us for our Civic Health Conference on August 25th. The conference is a free virtual event featuring Dr. Bayou Curry-Winchell as our extraordinary keynote speaker, along with a thought-provoking panel discussion featuring esteemed practitioners who are at the forefront of advancing health equity and immersive breakout session trainings that are really going to help equip you with the skills needed to effectively make change. And we want you to take a quick moment to show you a clip from Dr. Bayou.
Hi, it's Dr. BCW. Let's talk about how voting impacts our health. According to the CDC, up to 80% of our health is influenced by what is called social determinants of health. Local and federal laws, such as health policies, minimum wages, and environmental protections, directly influence our health outcomes. Unfortunately, communities of color, young people, rural communities, and disabled Americans face the most persistent voting barriers, and they are also often disproportionately struggling with health issues affected by these determinants of health. As a voter, you have the power to advocate for solutions that can directly impact you and your community. When you vote, you can promote policies that will create a healthier and more equitable environment for everyone. Vot-ER is working on just that. Vot-ER is a nonprofit focusing on nonpartisan civic engagement within healthcare settings. Founded by Dr. Alistair Martin, an ER doctor, Vot-ER empowers healthcare professionals, clinical students, and medical institutions to promote voter registration and civic participation among their patients and communities. So how does this work? Like at the DMV, where voter registration is integrated, hospitals, clinics, and healthcare professionals can play a vital role in promoting civic engagement. We wear a simple badge around our neck that looks like this and help our patients vote when they come in. In 2022, the American Medical Association proclaimed voting is a social determinant of health and significantly contributes to the analysis of other social determinants of health. Also, the National Voter Registration Act of 1993 empowers hospitals to conduct nonpartisan voter registration. Since healthcare settings provide a diverse cross-section of the population, it's a perfect setting for connecting with local communities. By integrating nonpartisan voter registration and education into healthcare settings, patients can be engaged in their civic duties and influence health-first policies. Voter readiness should be a year-round effort and not just during high-profile elections. So if you are a medical provider, social worker, or student in the health field, please join me in the movement and get your own free badge at Vot-ER.org/badge. If you are a patient, please register to vote or check your voter registration right now at the link above. Together, we can all make healthier communities through healthier democracy. This is Dr. BCW. Thank you for watching Beyond Clinical Walls. Don't forget to subscribe and turn on.
So we are going to drop a link in the chat to register for the conference. Even if you can't join the conference live, we do recommend making sure you register. That way you will receive the recording after. So one of the events that takes place during Civic Health Month is Vot-ER's Healthy Democracy campaign, which I mentioned earlier is one of the campaigns that I manage at Vot-ER. And that when we all checked our voter registration together, that you guys were helping put points on the board for one of our teams, the Lions at St. Leo's. This campaign involves social work students across the country who will be using Vot-ER's tools to participate in our first ever interprofessional HDC. Historically, the HDC, or the Healthy Democracy Campaign, has been a voter engagement competition between medical schools. However, this year it has been expanded to include academic programs for all health and human services programs, including social work. So if you are a student or if you work with students, this is a great opportunity for them to become familiar with civic engagement as a practice tool earlier in their career preparation. This year's campaign will run from August 1st to October 13th. So people can definitely still hop on board and join now. And our mission really is to empower people to become leaders in civic engagement, advance health equity, and become active participants in our democracy. I'm going to, or Chelsea will, share a form sign-up link in the comments for anyone who might be interested in participating within the campaign this year as a team player, or maybe even an advisor. Hint, hint. We always love new people joining on and coming to join the campaign. And if you work with students or supervise field interns, this is a great resource to help them meet their competencies related to advocacy and social justice work. One of the things, sorry, Chelsea, go back for 1 sec. One of the things that you're seeing on the slide is our high impact actions this year, which is something new we are doing. So while students will be using their badges to help people register to vote, we're also giving them the tools and the support to do some of what we are calling high impact actions, as you see on the screen, like hosting a badge training or getting 100 petition signatures, running a social media campaign, in-person events. So we're really taking it to the next level, not only giving them access to these really awesome tools, but really showing them how to flex that civic engagement muscle. And finally, there are also many other opportunities to engage at other events hosted by Vot-ER and our partners all throughout the month of August, which you can find at this link that we are dropping in the chat. Our organizing team will be teaching providers how to host voter registration drives at their institution, and we will be discussing how to navigate voter registration as trusted messengers on August 22nd, after the conference on the 25th. We will have even more amazing opportunities to learn about passing resolutions and proclamations that promote civic health and how to utilize open enrollment for civic engagement. So
if the NASW wanted to pass a resolution affirming voting as a social determinant of health, that would be a great session to go to. And I think I stole the mic early, but I think you're about to pass it to me.
Totally fine.
Great. And before we open it up for questions, which is coming up next, we want to give a huge shout out to all of the folks who are doing the work on the ground that makes victories like the one on your screen possible. Congratulations to New Jersey. Governor Murphy of New Jersey signed a proclamation naming August As Civic Health Month, it is now official in the state of New Jersey, and Vot-ER volunteers submitted testimony in support of this bill and wrote letters of support as it moved through both chambers of the New Jersey State Legislature. We wanted to give a special thank you to one of our volunteers, Eric Scherzer, for testifying in person. And New Jersey now stands as the second state to have made such a proclamation connecting health and voting, following Massachusetts in 2022. So good job, New Jersey. And with that, we have the remainder of the time set aside for questions. The chat has been amazingly active, which means I have not been able to keep up with all of the questions as I would like to. So Jeff and Christina, have y'all been keeping an eye out for questions as they've been coming in?
Yeah, so mostly there haven't been any questions directed directly to you all at the moment that I saw. So we do have about 5 or 10 minutes for questions. Why don't we invite people to raise your Zoom hand if you'd like to ask your question to Chelsea and Emily directly, or you can put it in the chat. As I see, I just have one. Is it illegal to engage clients in voting if I do not work for a nonprofit?
It is not illegal. You can do it in nonprofit settings. You can do it in government agency settings. You can do it in fact, the National Voter Registration Act confirms that like government, HHS departments, et cetera, can and should be doing this work. And as long as, I'll put in the caveat here, you cannot engage in partisan voter registration work. So what that means is that you cannot encourage people to vote for a particular candidate, a particular party, or a particular policy, or like ballot measure, while you are engaging in this voter registration work. And so oftentimes if someone is registering a client or a community member, regardless of whether they work at a nonprofit or in a health setting or whatever, if someone says, well, who are you going to vote for? What we encourage you to say is, I'm going to vote for you and your health. And what's most important to me is that you also get out there and vote. So putting it back on the client, right? Just like we would in a therapeutic setting where we don't have all the answers. We're here to walk with you and to ask you good questions because you have the answers.
Thank you.
Great question.
Let me briefly, I think I can address Cassandra's question. And if there's more to it, we can go from there. Cassandra asks, is there a badge option for those not affiliated with a specific organization? Cassandra, I don't know what state you're in. However, if you are in New Jersey has virtual Vot-ER badges that we had created last year during Civic Health Month. So if you are not tied to having a physical badge that you can hold in your hand, on the NASW New Jersey Civic Health Month webpage, there are downloadable badges that can be scanned. There's a downloadable screensaver for your phone. And if you use those, you will rack up points for NASW New Jersey in the contest to see who can help the most people register to vote. So let me really quickly drop the link to our Civic Health Month page in the chat. And then Chelsea, if she is not in New Jersey, suggestions?
Yes. So our individual badges are available to any providers. And these are actually physical badges like the ones that Emily and I are wearing, that any individual, like you could volunteer as a shift escort at Planned Parenthood and you can order one of these, right? Like we don't ask that you credential yourself with any particular institution. If you do connect your badge back to an institution when you're ordering it, it will show up with your institutions. Like if you put organization here and you put NASW New Jersey, for example, NASW New Jersey would be able to see, like they would also get points for that scan, right? Because you're affiliated with their organization, but you don't have to be to get your own individual badge. So I'm going to put this link in the chat. And for the digital kits that Jeff was just describing for NASW New Jersey, if you do have an institution, or even for just an individual, like a private practice agency, like you could get a digital kit. And these are basically, it's like a Google Drive that has a bunch of different types of resources in PDF and printable formats so that you could use them as is. Like if you do telehealth, you could set it up as your telehealth background, or you could print it. So it also comes with a digital badge, like Jeff was saying. So if you have an in-house printer and you wanted to distribute a bunch of physical badges, you could send your printer the file for the printable badge in the folder and still have access to those.
Thank you so much, Chelsea. Other questions for Chelsea or Emily?
I'm seeing one that says, any tips for engaging people who don't want to sign up as a means of avoiding jury duty? That's a good question. It's a myth. It's a myth that you can avoid jury duty by like not registering to vote, by not like getting your driver's license. You don't have to be registered to vote to be summoned for jury duty. So if that's like their one thing and they're like, oh, I'm just not registering because I don't want to get that call, like you might get that call anyways. So it's not going to take that option off the table for you. I don't know if that's helpful, but I think it's so funny when people like associate it so deeply with registering to vote. One political party actively wants less voting. How to deal with this reality? A very real reality. And I think the best way to deal with it is for us to not let them control the narrative, right? Like half of what we are fighting for by having the conversation about civic engagement in these spaces is normalizing the conversation about civic engagement and voting, right? So even if someone is registered to vote, maybe they have become burnt out or apathetic, et cetera, because there is one political party that has created this narrative, right, around voting and is facilitating an environment where it doesn't feel like our voices matter very much. And so half of what we are fighting for is to start the conversation, and especially so like in spaces like healthcare institutions where we are like looked at almost as experts of some kind, right? In whatever field, like experts on mental health, experts on et cetera, like to look at someone and say, your voice matters to me and I want you to vote, like that has a profound impact in countering that narrative. Are we allowed to inform clients about the initiatives on the current ballots pertaining to their health and healthcare as long as we are bipartisan/nonpartisan? Yes. So you could say, I want you to know that even if you don't vote for any of the candidates running for an elected office, there are 3 really important ballot measures on the ballot in this upcoming election that may be related to reproductive health care, opioid settlement funding, and education funding. And I'm not going to tell you which way to vote on those, but I do think it might be worth looking into to see what would be, what would impact you in the way that you would want to be impacted. Are we certain that states like Florida, Georgia, and Ohio that are passing all sorts of new laws to prevent or make it risky to help people register to vote won't restrict or retaliate? I know the federal law protects it, but in Florida, but in Florida first, there were consequences for healthcare providers here, and then you have to fight it out in the courts to get justice. Has anyone tried this in states that have these horrible laws to narrow voter access? So utilizing thank you, Christina. Utilizing Vot-ER's platform for voter registration is legal in the state of Florida. Voter registration is still legal, but it has been challenging utilizing paper registration and third-party vendors. Texas is another state where you actually have to be a registrar in order to register voters. So those registrars can use our tools, but we as with the rest of Texas laws, if you aren't a registrar, you can't use our tools to register voters. The thing I will say is that, and I don't know if this is too cliche, but use it or lose it, right? The more healthcare providers that are engaging in the conversation now and aren't waiting until it's too late, the better chance we have at preventing us from getting to that place. So I'm in North Carolina, where our gerrymandering laws and our maps and our access to the vote for folks with felony convictions have been under a back and forth in the Supreme Court for months and years now. And and that's not going to prevent us from approaching folks who have a felony conviction while the law stands that they can register and participate to vote, right? But we have to do that, or else, like, if we don't approach them when we can approach them and they don't vote in the next election, we already know that those elected officials aren't going to represent their needs and their right to have that access to vote, right? So it's almost like a chicken and an egg situation, but the bad kind. And we want to prevent us from getting even worse in this downward spiral.
Chelsea or Emily, could one of you repost the link for the Healthy Democracy campaign for schools? Someone was looking for that. I tried to cut and paste it, but it wouldn't let me.
Got it. Right here. And again, for the conference on August 25th, if you can't come to the conference, you should still RSVP if you want to have access to the recordings, because we only send them to the people who RSVP, because otherwise we'd be sending it out to everybody, and, like, you know, they didn't ask for it, so it wouldn't be the best idea. So that conference link, I'm going to send that one more time, is right here. And just because you register doesn't mean that you are signing your soul to attend, but it does mean that you'll get the communications about the event, including the recording afterwards. And I did see one person who said that they knew that they were registered at their new address, but the platform wasn't showing them as registered when they were checking. I will put out there that, like, this is our platform is a partnership with, like, all of the state board of elections, and then, like, a couple of other nonprofits who make it possible to consolidate this information like this. So that said, there are some communication delays that can happen, right? Like, the board of elections don't all instantaneously update when people register. Some of them go in, like, a flow of, like, every month we update the public facing records, right? So sometimes there will be a delay. And if you check now, you might want to come back and check in September and just see if that's changed at all, because that is one of the hiccups that we just unfortunately can't work around because of bureaucracy. So unfortunately, there are not CEUs being offered for conference attendance. That's a question I see in the chat. Last year, we were able to secure CEUs for some folks, but New Jersey, unfortunately, wasn't one of the states that licensed professionals could receive CEUs because of the differences in state requirements. This year, we have a new Vice President of Partnerships who stepped into the role that oversees Civic Health Month and the conference, and she doesn't come from a social work background. Our former Director of Partnerships did come from a social work background. So there's a little bit of an adjustment period, and I'm hoping that by the 2024 conference, we will return to having CEUs, but we just weren't able to get that done this year with the transitions.
Thanks, Chelsea. And then I also just wanted to point out the answer to one question that all happened in the chat. Jim asked if there was a resource that students can consult when they attend a school out of state. And if you didn't see, Christina responded further down the thread. The Vot-ER platform will allow students from out of state to check, update, and request ballots. And you can also visit vote411.com to find similar information. So it is 7:30, and I want to be respectful of everybody's times and let you all get back to your evenings. Chelsea and Emily, thank you so much for this fantastic and inspirational presentation. This is phenomenal information, and the comments that have been going on in the chat and everything, people are really excited about this opportunity. Before we go, I know that both Christina and I had a little bit of information that we wanted to share with you. Just some important dates to keep notice of in New Jersey and Florida. And I will also try to put this information in the follow-up email that you will receive. The follow-up email is going to have a link to this recording. It'll have a link to the slides, plus these voting date informations we're going to share. You will be getting a separate email. It will probably come first, actually, with your post-test link. You'll take the post-test on a platform called ClassMarker. It's 4 or 5 questions, and when you complete it, you can then download your CE certificate directly from ClassMarker. So before we go, the things I just wanted to point out in New Jersey and some notable dates. There are 3 ways to vote in New Jersey now. You can vote by mail, you can do in-person early voting, or you can vote on election day at your polling location. The voter registration deadline in New Jersey in order to be able to vote in the November general election is October 17th. And the New Jersey early voting period is from October 28th through November 5th. The location that you vote at during early voting will not necessarily be your regular polling location. You should check on the vote.nj.gov link for locations that vary by county. Also, the deadline to apply for a mail-in ballot by mail for the November election is October 31st. You can also pick up a mail-in ballot application for the general election directly at your local county election authority. And the deadline to get the ballot application for in-person mail, picking it up in person, is November 6th by 3 p.m. Election day is, of course, November 7th. And just again, a couple of resources here in New Jersey. If you have any questions about your registration, your voting, your precinct, anything like that, visit vote.nj.gov. And also for those in New Jersey, you can find Civic Health Month resources on the NASW New Jersey website. Just visit naswnj.org, and Civic Health Month is the lead feature on our homepage. Click on the Learn More and it'll take you to that page. And I will put all this information in the follow-up email that gets sent out. Christina, did you want to share information for Florida?
I would love to. Thank you for the opportunity. And again, thank you guys for hanging out with us. So a couple of things that I just wanted to point out, I'm going to put some links in the chat. Is we've been talking a lot about voter registration, and it is so important that we get as many people registered. But the other next step is getting people to the polls and also making sure that we can keep voting integrity. So don't forget to consider being a poll worker. And if you are interested in becoming a poll worker today, I'm dropping the link in there. We are in need of poll workers. There is a shortage across the nation, particularly in Florida. So if you are interested in participating that way and protecting democracy and seeing democracy upfront and personal, then please consider volunteering. As Chelsea said, oh, Florida. Florida has seen some challenges over the last couple of years. And one of those being in 2021, a new law was put in place that all Floridians who vote by mail must submit a new mail-in ballot request to their county supervisors of election. So if you voted last election by mail, you are not going to get a new mail-in ballot. You have to apply every single cycle. So if you are that person, here is the link to go ahead and request your new mail-in ballot. Also, if you are going to use the Vot-ER system, they do it for you too. Another reason for why you should do it. When are we voting? So Jeff gave out New Jersey dates. I'm going to go ahead and give you our primary dates and election dates. So our presidential primary election is going to be March 19th of 2024. Our primary election is going to be August 20th. And of course, the general election is the same everywhere in the country. If you are trying to get people to register in our state, we need to get them registered 29 days before these elections. That includes an upcoming election in Ocala. If you are in the Ocala area, you guys have an election on September 19th of this year for your city municipality. So it's not too late to register for the election. Registration needs to be in by August 21st if you are in the Ocala area. To vote in any Florida election, you must be registered 29 days before the election date and primary date as well. Students, I saw a lot of students here today. If you are a student in Florida, look out for some dorm storms. Now, what are Dorm Storms? Dorm Storms is sponsored by the People Power of Florida, and they are helping to register students as they move in on campus, which is a great way to use the Vot-ER badges too. So if you are at EFSC, FIU, UCF, FSU, UF, and FAMU, you have dates secured for your dorm storm. Just head over to People Power for Florida so you can see when. And last but not least, if you live in Florida, if you are considering joining NASW, please, we would love to have you help us here in Florida. NAS Florida is gearing up our advocacy and legislative agenda for 2023 and 2024. And to stay connected, please consider joining our legislative committee and becoming a member of NASW Florida. We need your expertise, your testimony, but most importantly, we want to learn and hear and help your community. So if you want to get more involved with NASW Florida, here is our contact information. I would love to see you join my committee and be a part of it. And also, if you are an NASW Florida member, don't wait to get involved in voting. We need your vote right now in our chapter election. Our chapter is currently voting on chapter leadership. So please vote so we can ensure your voice is being heard in the direction of the chapter. And to access your voting ballot, please follow this link. And I will leave my contact information if you want to get in contact with me. But everything we talked about is going to be super simple in the state of Florida if you use that Vot-ER system. I love it. I'm a true testament of it. I'm a huge supporter, and it's easy breezy. Jeff, I'll hand it back to you.
Yeah, thank you so much, Christina. So if you could just email me all those resources, I'll put them in the message that gets sent out to all the registrants.
Absolutely.
Perfect. All right. Well, we did promise to respect your time and then kept you 10 more minutes. So I'm going to now say, I think the webinar is officially over. Thank you all so much. Watch for follow-up via email for your CE certificate and follow-up resources. And we will all see you at our next program. And thanks again to Christina and Dawn and NASW Florida for joining us in this program, and to Chelsea and Emily from Vot-ER. Have a great night, everybody, and we'll talk to you soon.